For my teaching plan, I will be teaching my patient on a new prescription of Flonase nasal spray medication, overview and proper use of. My patient is a 22-year-old male with a history of seasonal allergies. The patient is motivated to learn about proper use of Flonase nasal spray to relieve his symptoms of seasonal allergies. The patient's health beliefs and values include being a full code with family involved and as a Christian. The patient has made adjustments to his daily living by staying indoors on days when the climate is dry and windy. The patient tries to stay inside during days when the pollen count is high. The patient is an electrician and has a degree in agriculture. The patient is independent with no difficulties of reading or writing. The nursing diagnosis for this patient is risk for disturbed sensory perception, olfactory, related to history of allergies as evidenced by nasal congestion, sneezing, and runny, itchy nose. During the teaching plan, I will begin with gathering information from the patient's history, as I'm doing now. I then will go on to discuss why the medication has been prescribed. As the patient and I discuss the material, I will offer opportunities for questions and answers. I will review the proper use of the Flonase nasal spray to the client and then have the client demonstrate back. This will initiate a teaching back moment to evaluate the patient's understanding of the material being taught. I will provide the patient with a medication guide to help maintain the client's attention and for the client to have on hand when needed. All of these methods will include the patient in the teaching to involve participation of the client during the teaching. Good afternoon, Mr. Lemon. Today I will be going over Flonase, a new medication that you've been prescribed, and proper use of how to use it. Do you have any questions? Is it a good time right now?
Yep.
Okay. First we will begin with a medication overview. So your medication that the doctor has prescribed is Flonase. The dose that you will use is 2 actuations in each nostril. You will do this each day. It is a nasal spray. The classification of this medication is a corticosteroid. So how it works in your body is it will prevent the release of substances in the body that cause inflammation. The reason for using this is your allergies. There are quite a few contraindications of this medication that you might want to overview. They will be on the medication guide that I will give you. The side effects of this, some of them are headache, nasal burning or irritation, cough, abdominal pain, bronchitis, and nasal ulcer. Those will also be on the medication guide for you. It will be, as a nurse, we will need to monitor your respiratory status. This may lead to decreased bone density, and it is important to wipe the nozzle with a clean, dry tissue after each use. You want to use this cautiously with any untreated infections and suppressed immune system, so you'll need to talk to your doctor before that. But all these things will be on the medication guide if you have any questions. Now we will discuss proper technique of how to use the Flonase nasal spray. So with this bottle, you're going to shake it, and then you'll gently remove the cap. For the first time use, you'll prime the bottle for use. You'll do this by aiming the bottle away from your face and pump it until you see a mist. You'll blow your nose to clear your nostrils. You'll close one nostril and place the tip of the nozzle in the other nostril, sniffing gently as pressing down on the spray nozzle. You'll breathe out of your mouth and then spray one more time with the same procedure. Finally, repeat on the other nostril. Then you'll wipe the nozzle with a clean tissue and replace the cap. Do you have any questions for me right now?
Nope.
Okay, are you ready to do a demonstration of how you will use this?
Sure.
Okay. So first you want to shake the bottle with the cap on. Okay, and then you'll remove the cap. You will blow your nose to clear your nostrils, which you have already done in the restroom before I got in here. You will close one nostril and place the tip of the nozzle in the other nostril and sniff gently as pressing down on the spray nozzle, breathing out of your mouth, and then spray one more time with the same procedure. And here is your medication guide provided to you. And if you have any questions, please let us know. Before discharge, we will also ask you again if you have any more questions. Do you have any questions for us?
Nope.
Alrighty.